And welcome back to the program, and you are still with me at Bangkok Hospital, where we are talking to Dr. Supakor Rojananin about some of the important questions that women and men, of course, should know about breast cancer. So let's continue with our discussion. Well, if, for example, someone has a cyst and they know that they have a cyst, can it actually develop into something that's very serious, like cancer?
Cysts rarely to develop to turn to cancer. Cyst is the result from the hormonal change of during the period, and in any month of the menstruation, the breast will develop some of the fluid, and if the breast develop more fluid, they might collect like becoming a cyst. And if it's becoming larger and larger, people will feel like a very painful in their breast and notice a lump. The treatment is very simple. It's just to aspirate it.
Okay.
That's it. You don't need to have the surgery at all.
So nothing too serious?
Nothing too serious.
Okay, that's good to know.
But people usually serious about painful. We call it mastalgia, painful of the breast. But usually the cancer never develop any symptom.
Okay. Well, Angelina Jolie, she has decided to undergo a double mastectomy because she found out she has the BRCA1 gene. Could you explain to us what that is?
BRCA1 gene is a suppressor gene to control not to let the breast cell develop to be cancer later on. But any of these genes that has some mutation is good, but some mutation is not good. So the suppressor gene is not active. So eventually, in those people who have the mutation of these genes will develop cancer. But the time to develop, we don't know.
Okay.
So in these people, we take risk. And the risk increasing every year, about 2 or 3%. And as you said in the newspaper, about more than 80% will eventually develop cancer. So these people have to wait and see, and making the so concerning and some stressful for them.
So obviously she didn't want to wait.
She didn't want to wait. Yeah.
Well, she decided to completely remove her breasts. But is that a recommendation that you would give? Is there a possibility that she could have done something else instead?
She might use medication. But the medication, the effectiveness of the medication is not as high to prevent the cancer like doing the surgery. But doing the surgery is too extensive.
Yes.
And costs some of the quality of life, and too extensive method to do that. And you have to judge what is the cause, but it benefit, but it's harmful to you. But if the patients have very high risk, about like a family, in their family root, they got too many their relative, like a mother or sister, develop cancer. And also, if this lady had a mutation BRCA1 gene positive, in the case it might be fulfilled to do the prophylactic mastectomy.
Okay. Well, this is a question for not only people who have the genetic mutation, but also people who have breast cancer. If you remove your breast, be it completely or partially, can you still have children?
Yes.
So it doesn't affect at all?
No.
But will it affect your ability to produce milk when you are pregnant?
It affects the quality of life. The patient, about most of the patients under 50, they're concerned about the cosmetic, the beauty. The breast is the feminine symbolic organ, so most of the patient need to preserve as much as they can and as possible. So as a doctor, we also try to keep the breast, but to keep the breast and to make a competitive resolved as mastectomy. You don't have to. In the old day, if any patient who got the cancer, they need to sacrifice one of the breasts. All cases. But nowadays, the patient come very early, so not only we can cure it, we can save the breast as well. So in the first place, we need to consider, can we save the patient's breast or not first? If we can save, we save it.
You mentioned that the breast is what makes us feminine. Do you think it's true that most women would rather have to cut their ovaries than have to cut their breasts?
Ovary is producing the sex hormone, and these hormone we call the estrogen the breast will be the end organ for the hormone. So most of we don't know the cause of the cancer, but we know that these estrogen affect the tumor growth. So if you cut the ovary and not to producing the estrogen, it might to prevent breast cancer. I think so.
Well, you mentioned earlier how it's best to go to the doctors rather than examine for yourself, whether or not you have a lump or anything strange.
If the tumor is small, the doctor also they don't have capability to diagnose, to examine it, because we have a high technology breast imaging. The breast imaging can detect very small cancer, asymptomatic cancer, less than millimeter as well, about 1 or 2 millimeter. This nowadays technology can detect. I think so.
So, would you recommend someone perhaps to do a self-examination on themselves?
Self-examination is good for some group of the patient. Like in the United States or Western world, we have high technology. The people is well educated, so they come very early, and the success rate of the treatment is very high. But in developed country, even in Asia, you can see that most of the patients come very advanced disease and very late stage, like the breast, the lump, the bleeding, and swelling and invasion to the skin and whatever. In these stages, we have to reduce to a smaller lump first. So it might be a benefit for other area in a rural or in the developing country to encourage people to examine the lady to examine the breast. Hopefully, they will come more early with a small lump.
How often should someone go and get a physical checkup?
Checkup for every 6 months.
6 months? Okay.
Medical checkup and monthly self-examination.
What can you expect when you go to the doctor's office?
For the doctor, we usually recommend to see the surgeon, the breast surgeon, and doing the breast imaging. We have the mammogram or digital mammogram, and we also ask for the ultrasound, because these two equipment is not competitive, but it to enhance the capability for diagnosis of the breast. The ultrasound is better for the pregnant woman, and if you are pregnant, you need to speak up because the mammogram is X-ray, and it might be harmful to the pregnant women. But actually, the ultrasound can find like a lump, a small lump, about 2 millimeter. It can be detected, but the mammogram can demonstrate the micro calcification of the tumor.
But do you recommend chemotherapy or any other sort of radiation therapy?
All of these have its indication. Not all of the patients need chemotherapy. and not all need radiation as well. And the option for surgery, we have two options. The first is to remove all the breasts. We call them mastectomy. And the second one is just remove adequate tissue of the adequate resection of the tumor, preserve the breast, but you need to add the radiation. By doing two options, mastectomy, remove all the breast, remove just only the tumor, preserve the breast, add radiation to the breast. The result the same. To have the mastectomy, remove all the breast, you have to offer for reconstruction as well. Because the reconstruction of the breast, we have two options. The first one to use the tissue of the woman herself, but other use the implant. And the time to do the reconstruction, we have to delay reconstruction for after mastectomy for 2 years and do the reconstruction, or do immediate the same setting. And people usually like to have the immediate reconstruction.
Do you think a lot of people delay coming and get a health check?
Some people are afraid that they're going to have breast cancer and they're going to lose their breast, so they're afraid to come to see the doctor. But anyway, Thai is better than other ASEAN country, and we can see that during the 20 years, the patient come very early, and we can detect with earlier stage of the breast cancer more than other countries.
Do you think Thailand is very technologically advanced compared to other countries?
And the health education is improving, and I think is being Thai, they have adequate and I think the most benefit and very advanced healthcare.
And what can we expect to see coming in the future in terms of technology? Because I'm sure there will be definitely a lot of advancements. Has there been any research that has come out to say what will help people with breast cancer in the future?
Now, most of the scientists and surgeons, they study about the lipofilling or the stem cell, the fat, because most of the component of the breast, they are fat. And if you remove some or part of the breast or whole breast, now we don't need doing a very extensive surgery, but in the future, just implant or refill your own fat to the breast, little by little, and it become growing to the same size. The benefit and the advantage of the lady who come early is they can save breast, and also the success rate of the cure of the treatment is higher. Or we can say very simply that come early, you save your life and save your breast.
That certainly is a wonderful message, and I have to say thank you so much for sharing with us your expertise and your knowledge, and also giving a good message of encouragement to get people to be more concerned about their health and also their breast as well, not only for women but also for men. And thank you for joining us for In Focus today. Well, I have to say thank you for joining us, and I will definitely be seeing you again on In Focus. And we have to once again thank Dr. Supakon Rojana In from the Bangkok Hospital. Thank you so much. สวัสดีค่ะ